Okay. All right. Good afternoon, everybody. Welcome to the first in the series of many to come global webinar series on Ayurveda research. One second. Yeah, sorry. So welcome everyone to the first in the series of global webinar series on Ayurveda research. We are delighted to announce and launch these lecture series, which will be on a variety of aspects of research in Ayurveda, on Ayurveda. And we have launched these series in USA as well as India. Today, we have Dr. Namyata Pathak, and in a minute, I will hand over the mic to Dr. Asavri, who is our chair for these webinar series. But before that, I'll just take a couple minutes to welcome you all and make some housekeeping announcements. So I am representing CAR as the founder president of Council for Ayurveda Research, which has been founded to educate, engage, and facilitate the Ayurveda fraternity in basic clinical as well as interdisciplinary research in Ayurveda. And everything that we are doing, it's a 100% volunteer-based organization. Everything we are doing is towards this mission and vision. I will keep the introduction of Council for Ayurveda Research very brief. I just want to conclude by saying that please do check out our website. Please do join as a member. It's a very nominal fee, but it gives you access to all of the recordings, archived recordings, resources, etc. And also please check out our volunteer form, which is also on the website. And please consider volunteering for the organization, because the more documentation we do, the more we will be able to bring Ayurveda to the global platform. So with that, I would like to hand over the mic, so to say, the virtual mic to Dr. Asavri. Dr. Asavri, all yours.
Thank you, Dr. Pratibha. Namaste, good afternoon, everyone. Welcome to CAR AAAF Ayurveda Research Webinar Series. I'm Dr. Asavri Manvikar. I'm based out of Minneapolis. I have been practicing and teaching Ayurveda for more than 20 years. And I am a founder and lead faculty of Minnesota Institute of Ayurveda and also graduate faculty at the University of Minnesota. And I would like to begin by introducing our guest lecturer, Dr. Namyata Pathak. She is BAMS MD Kaya Chikitsa from India. Dr. Namyata, the Vaidya scientist, is trained extensively in both Ayurveda and modern biomedicine from more than a decade in India. She was selected as the youngest Vaidya scientist and has been engaged in multiple interdisciplinary projects driven by the spirit of Ayurveda. She teaches at the leading Ayurveda schools here in the United States, steered to implement its fundamentals for integrative health practices. She consults health seekers out of her Ayu Care office in Fremont in San Francisco Bay Area. She particularly has extensive interdisciplinary experience in cardiometabolic health, neurodegenerative diseases, and women's health. She has designed integrative programs for them. She has also spoken at several international interdisciplinary conferences, community health initiatives, and government health conclaves in India as well as US, including NIH. She has many international publications to her credit, and she is also the editorial board of Journal of Ayurveda and Integrative Medicine for a decade. Dr. Namyata will be presenting on possible avenues for insightful clinical research, her own experiences from the dissertation on Parkinson's disease. Welcome, Dr. Namyata. Please take over.
Thank you so much, Asavri ji, Dr. Asavri, Dr. Pratibha. And I really thank the platform for CAR to give me this honor and privilege to be the first speaker in the global webinar series, which I'm sure will reach to many across the world. and be able to provide a platform to all of these amazing colleagues that we have. And it will give a chance for us to engage. So thank you so much for taking on this initiative and making this possible. I uh, I have this. I have while thinking about what I want to talk about for the first time, I thought I should share with everyone the journey in research, my own journey in research, uh, as to how I did it and how I was carried from one thought process to the other and guided by so many in the field. I want to share that, use this opportunity to share that. So, with great enthusiasm and a lot of nostalgia, I have prepared this talk, and I hope that all of you enjoy this story. Okay, it is a story. It is not a hardcore data-driven research presentation that I normally do. It is different, and I hope that it encourages everyone to do the same and come and share on the platforms that CAR has created. Okay. So with that, I am sharing my screen. Just give me a moment. So I do have a little update for my engagements, and I have recently joined MD Ayurveda as the chief of Integrative Ayurveda, and I will share more in the coming months as to what we are up to at that amazing opportunity that has come presented to Ayurveda. I have also recently become the education chair of the California Association of Ayurvedic Medicine, and that is also an exciting platform to grow our community and our fraternity and prepare for the future. I want to begin by sharing one quote that I repeatedly heard when my mentors taught me, and that was that research should spell fun. And this was really important to hear as a feedback when you would read about all of the daunting, detailed processes that the contemporary research is typically characterized to have. And as a student, it was not about navigating those institutions and those organizations. It had to be driven, the research quest had to be driven by something internal. And it is an internal quest of curiosity and of the joy of finding out and of the angst of not knowing enough that drives us to our learning process. When you have questions, there are answers out there. We go and seek the answers that are readily available. And when the answers are not available, you pose a question and you design experiments. And how do you design those experiments? How do you frame those experiments? What do you observe? What does that data tell you? What do you learn from it beyond the numbers? Also the numbers and beyond the numbers. That is the part of the journey of research. It is the enthusiasm of the spirit. It is the drive of curiosity that is going to sustain it and take us to uncharted lands. With my mentors, I went through many different areas, but the one that I dived in deep was the area of Parkinson's disease, because that's what was the mandate for my MD dissertation. And I want to share with you about what I did, what it led to, how did I do it, and how can you? That's what this talk is about. So what I did first is summarized in this poster, and I have sort of, put my poster back here. It eventually led to being a randomized exploratory study for non-motor symptoms of idiopathic Parkinson's disease with an oil-based enema-like Ayurvedic therapy called as Anavasan Basti. Okay, and Parkinson's disease, to give you a little bit of a context, is known to be a motor dysfunction disease, and it's characterized by tremors and slowness. But these are just some parts of the whole complex. And we know in general that it is dopamine deficiency that leads to that, because dopaminergic neurons tend to degenerate, and there's not enough dopamine in the system, causing the motor dysfunction. But increasingly in the last 15 to 20 years, it is being understood as a complex multi-system neurodegenerative disease, which originates in the gut much before it affects the basal ganglia. The manifestations also include, The manifestations also include debilitating non-motor features like constipation, sleep disorders, fatigue, anxiety, painful sensations. These are frequently missed, unaddressed, and significantly affect the quality of life. Similar symptom complexes have been described in Ayurveda along with treatments for these. We studied one such treatment modality in well-identified patients of idiopathic Parkinson's disease using an extensive clinical rating scale. So this is what I did. Okay. The methodology was, I had an intervention. From the texts, I studied many texts and decided that Mashadi Tail Basti that was described in the Sahastra Yoga would do very well for such patients. So I prepared that. And I also prepared a Murchit Tilatel, which was not with all of the regenerative herbs that Mashadi has. It was just like a plain Tilatel that was used as a comparison. I screened more than 75 patients using the Queen's Brain Bank criteria, which is a very stringent criteria as to who do you call has Parkinson's disease. Now, this diagnosis is a diagnosis of exclusion, which means that the patients really need to sort of negate out everything else. They might need to do MRIs and CT scans, and then they would have been identified to be idiopathic Parkinson's disease, because Parkinson's disease can be of multiple different types. So I screened those and got just the IPD cases. And I would refer to the neurologist. There was a doubtful diagnosis for uncontrolled patients. And the ones that were diagnosed, I would screen them for further inclusion-exclusion criteria. The study required the patients to be admitted in the hospital. So we went through all of the process for the written consent and the randomization, the counseling. And then they were divided into two groups. I eventually had 15 cases, which I studied and I reported in the dissertation. And they were Mashadi. So group A had Mashadi Tilatel Basti, and group B was 7 patients of Murchit Tilatel. I had a baseline assessment and an intervention, then the assessment in second week, and assessment at the first week, second week, and later on a follow-up at 6 to 8 weeks also. I have been later on, I am in touch with some of the patients. I was in touch with some of the patients. This is 10 years ago that the study was done, more than 10 years ago. The clinical scale that was used was MDS-UPDRS, that is the Movement Disorder Society's Unified Parkinson's Disease Rating Scale. And this scale came out in 2008, just when I was about to begin my dissertation. Before that, they used a scale called as the UPDRS for many years. And thankfully, because I was doing constant literature search, I was able to use the latest tool to do the assessment. And I had to learn how to use the tool. So I went to some of the top neurologists practicing in Mumbai, and I learned with them at the clinics as to how do you rate Parkinson's disease patients. Some of the statistical methods that were used, they went on to using the Mann-Whitney tests, were the non-parametric tests, because they were more relevant for the data analysis for this sample size and the nature of the distribution. Okay, what did I find? That in group A, the total modified MDS-UPDRS score, at the second week, there was a reduction in the full rating, and that rating scale has more than 70 points. And you could see that this was a significant reduction at p lesser than 0.01. In the group B also, there was a reduction, but not that much. It was not significant because it missed it by 0.01%. And if you see the group A, the non-motor scores and the motor scores. So you see there's a bigger drop in the non-motor scores. It was more significant. It was more significant, this non-motor drop. And the motor score also reduced, okay, at p lesser than 0.05. Now, whenever you see this number of p lesser than 0.005, that means that it is highly significant, okay? In terms of individual symptoms, you saw that there was a drop, significant drop in constipation, in anxiety, in fatigue, in the tremor experience, in painful sensations, and in the global spontaneity of movement. Now, all of these symptoms are rated individually, and I will show you how this was done. This really gave me a solid understanding of the extent to which and how the Ayurvedic intervention could change the experience of the disease. It was a short study for 16 days and followed up. So I cannot make long-term comments on the ability of disease reversal or need for reduction in the treatment, reduction in external levodopa, and all of that on the basis of this study. But this study at least showed me some of these aspects of the disease that were definitively changed over a duration of 16 days. So I concluded that there's a possibility that we can include Basti in the therapeutic armamentarium for Parkinson's disease, in idiopathic Parkinson's disease, if it's confirmed by further studies. And I also kept open to the possibility of the scope of neuroprotection with the Dania somnifera, levodopa substitution for potentially reduced dyskinesias with mucinaprurians, and a whole system Ayurvedic therapies, which may all enhance clinical avenues for management if systematically followed up with an integrative rationale. Okay, so some of the other conclusions were made on the basis of the observations in general that I made beyond this study as well, but during the part of the dissertation itself. Okay. So what did this lead to? Okay. Before I get on to that, I wanted to share that, through this particular study, I did not see too much direct benefit for the experience of tremor, okay, and also rigidity. It did make some difference, but it did not make that much of a difference in that 16-day period with this particular intervention. So I had some parts of the puzzle solved, some parts that were not solved, or we were not able to touch those. So this understanding that evolved for which parts of the whole problem were we able to influence, it got me to develop a very detailed understanding of the disease complex itself. And I was eventually invited to write a review along with my mentor in the Journal of Ethnopharmacology, which is considered to be one of the top journals in botanical medicine today. And if anybody wants access to this, I will be able to share this. And it has led to a lot of people coming and engaging with me for insights with Parkinson's disease and Ayurveda. I also wanted to share about, I wondered how would this kind of form of treatment, whether when we did an Ayurvedic Panchakarma on a regular basis for patients who are suffering chronically, what would it lead to? Is there any experience or evidence? We can say theoretically, yes, it will reduce the need for levodopa. It will improve quality of life. But was there any real life experience? Okay. And when I had presented this work at one of the conferences in India and the World Ayurveda Congress, that time Professor Harsh Shuntak, he had come from Germany to share similar responses with the Nasya treatment that he had done. And that was a signal for me. And then later on, 3-4 years down the line, I got an opportunity to go and visit his hospital in Germany. And my mind was blown to see patients who would come from, on a regular basis. It was like their annual or biannual retreat that they would come in, take Panchakarma therapies. They would be sitting around. They had a really nice Ayurvedic kitchen with such amazing food that was prepared. And the doctor on the top right, you see Dr. Sandeep Nair, who is the Vaidya who's joined Dr. Horst at his clinic, and he runs the entire team for Ayurveda and Parkinson's disease there. So when I saw that, and I heard from patients that, it has made a big difference in their quality of life, and they don't need to increase their doses as much, it gave me certain other experiential evidence support to explore this idea further. So I want to share with you as to how did I do it, because I did not always know about non-motor symptoms or know about this landscape of Parkinson's disease when I chose it for my dissertation. I really just thought it was a motor disease, right? But how did it come about? And this is the exciting part as to how do you approach a problem. Okay, that's what I wish to share with you through this story. So the timeline of this was in September 2007, I submitted my synopsis. And I started off by watching a movie, okay, on Parkinson's disease. And it was by Robin Williams and Robert De Niro. It's called Awakenings, and it's based on a true life story. It was based on an epidemic of a Parkinson's disease, like a motor disease called encephalitis lethargica, which affected millions of people in the early last century. And that gave me some sort of an insight into what kind of a life do they experience. And through that, I went into the details of the medical aspects and the constructs and the theory and the history and the biochemistry of, of this problem. So I attended neurology clinics in 3 or 4 places in Mumbai. I learned PD assessment from a fellow who had come, from a neurologist who had come to the US to learn the MDS UPDRS, and he had just joined back to in the Jaslok Hospital in Mumbai, which is a very reputed institution. So that's Dr. Petrus Vadia, who I went to learn. I joined the Movement Disorder Society of India, attended their support group meetings, eventually contributed articles with them. I saw the promise of the yoga therapy that was offered to the patients. And with all of this understanding, I zeroed in on defining the formulation that I wanted to use and started preparing for it. I also, by the grace, a stroke of luck, I had a friend of mine who shared with me whatever latest research I wanted. So I have like a massive Parkinson's disease library that was collected with me by then. And then after I prepared the formulation and I had some trickle of patients coming in because nobody knew that I was trying to do a thesis on Parkinson's disease, right? So I was a student and I didn't actually see as many Parkinson's disease cases because I had to do 30, right? And I had to submit the thesis by by September end or October of that year. And until May, I had just had like 3 patients who had come to me. So I had all of this knowledge and everything, and but I didn't have patients. So then we did. Then I did an integrative camp, and this was possible because I had the support of the dean, the uh, also the director of this of Ayurveda in the state of Maharashtra. They all supported me to uh, allow a camp to happen, and this is something that never happens in India, or it wasn't a regular feature. Okay, it was the first time something like that happened, and I'll show you glimpses of that. And then eventually, from that camp, there were 42 patients who came, and I enrolled 16 patients, and I did my clinical study and wrote the dissertation. Okay. So that's what the camp really looked like, some images of the camp. And I was really nostalgic looking at all of these when I prepared it. And we did multiple things during the camp. We did a knowledge attitude practices survey. We did an Ayurvedic pharmacoepidemiology. We did symptom surveys. And we provided advice from Ayurveda and occupational therapy to the patients and any other medical condition that could be supported. Now, in this camp, I had the support of the highest authorities. My interns came on a Sunday. This was a Sunday. I had like an army of interns, the colleagues, my MD colleagues, they all showed up to take care of the patients. And my mentors did. And my entire research team from Kasturba Health Society came to support. Also the PDMDS Society, right? The Parkinson's Disease Movement Disorder Society. Because by now, everybody knew what I was trying to do and how I was trying to do it. And everyone just flowed. The energy just flowed. Oh, some reason this slide has not come up. But this was essentially the patient profile of the this was the patient profile of there were 42 patients, and how many males, how many females, what age group, how long they've had the disease. And the table down actually showed the prevalence of non-motor symptoms when we did the symptom survey. So all these things that I'd read about in the theory, I actually saw that people are really suffering. More than 60-70% of the patients complained of those symptoms, which were completely unaddressed, and they immediately impacted their quality of life. Oh, okay. There they come. Yeah. So you have, constipation, sleep, sensory issues, cognition and memory, neurobehavioral, autonomic, fatigue, weight loss. Right? So that gave me a signal that I definitely need to assess this well. And we began using the MDS-UPDRS scale. Now, what does the scale really look like? I'm just going to read about the constipation, okay? Uh, which is a subjective feature, so as to speak. So if somebody does not have constipation in this, you would say 0. Or if it is slight, that is, I have been constipated, I use extra effort to move my bowels. However, it does not disturb my activities or my being comfortable. When it is mild, constipation causes me to have some troubles doing things or being comfortable. When it is moderate, it is constipation causes me having a lot of trouble doing things and being comfortable. However, it doesn't stop me from doing anything. When it is severe, I usually need physical help from someone to empty my bowels. So when you see that constipation in PD can become really severe, now, this is not a constipation scale that you would use for normal uh, the general population, but for PD, this is the way in which it gets rated. So these kind of scales enabled uh, me to really understand the life of a Parkinson's disease patient individually. When we had 70 such rating scales. Uh, Role of my mentors, I wanted to share at the camp how they all came, I'm sorry, my slides went up and down. This was supposed to be earlier, but I wanted to give you a glimpse of my mentors. And this is Dr. Ashok Vaidya, MD, PhD, who was also involved in the first clinical trials with levodopa at Yale University in the early 1970s. And he went back to India. He used that understanding to test and study mucinapruriens for the first time for Parkinson's disease. Everybody now knows mucinapruriens and says that it has always been written in Ayurveda that it is good for Parkinson's disease. But frankly, I have not found a single reference that goes back to that particular use case scenario. And Dr. Vaidya was the first one to actually study mucinapruriens for it. And then it led to multiple other studies and product development. I'll give you a glimpse of him. I have a video of him addressing all the patients on the camp day.
I firstly, we come across something and we show to the world that yes, this affects the neuropeptides, this affects the nitrostriatal pathway. I think we are having global impact in terms of Ayurveda's great knowledge. Thank you.
So that's him. And Dr. Rama Vaidya on is his wife, and she taught me how to actually create on ground, implement science using IQ, EQ, and SQ. And medical sciences. How do you put it together for a patient? How do you put it together for a program? How do you put it together for a profession? And with both of them, I mentored for 5 to 7 years. So these are the giants, these are the mentors, these are the thought leaders on whose shoulders I began my journey in research. It has taken me very far, and it has given me a lot of clarity, and it has raised a lot of questions. But if you have to go on the path of research, how can you do it? I wanted to share one very defining moment that liberated me and liberated my mind 10 years after being in Ayurveda. You know, Ayurveda, we always define it we always think of Ayurveda as, natural products or practices, and, this is the way we should do it, or it's about the doing and the products, right? But when you actually see when you actually see the definition of Ayurveda, it says hita hitam sukham dukham ayudasya hita hitam manam chittacha yatra uktam ayurveda sauchyate. Now this is very translated, it has many different translations, and people have always wondered as to what it really means. For me, it meant that there are different kinds of outcomes of life which are possible, which are positive and negative, hita, ahita, sukha, and dukkha. But the measures of, the interventions or the choices that you make, how fast they take you towards which outcome, how intensely do they take you towards which outcome, that understanding of that measure, that man is measure, that is Ayurveda. And it is nothing but loosely translated into understanding the cost, benefit, and risk for health for every choice that we are making, every clinical decision we are making, every life choice we are making. And this was much debated and discussed with Professor Lakshmi Tadacharya at the Vaidya Scientist program, and he approved my way of thinking about Ayurveda's definition. And it really opened up a whole new world, because now Ayurveda could be enterprising, and it could be integrative, and it could be real, and it could be contemporary. Ayurveda's measures are a bedrock of Ayurveda. Charaka has dedicated an entire sutra, entire sthan, the Vimana sthan, to the idea of measures, which are of quantification. They were not gross quantification, but they were relative measures, and Ayurveda is created on the basis of relative measures. So there are avenues that we can create in our daily life and practice for measures, for benefits, risks, and costs. I won't get into the detail of this right now, because we can exchange some Q&As, and maybe we can get into this depth later if everyone is interested. But there are detailed thoughts behind this that we can use to steer the profession further. So those measures that are there, they can be quantitative, or they can be semi-quantitative, or they can be qualitative. Some of the semi-quantitative measures are the ones that Council for Ayurveda Research is beginning to put together. We call them as outcome measures. So if you have a particular kind of a case, and you want to know which scale you want to use to see the baseline, and later then you can use the outcome measures that Council for Ayurveda Research is beginning to put together, or you can of course find out on your own as well. But I'm really excited about this space, because it can enable and support anyone who is inclined. In the field of observation, chance prefers the prepared mind. And it is not just about, just applying a scale randomly. We have to know the context of the scale, and the preparation of the mind for making that observation is very important. Where are you going to invest your energy to do that? What tickles your mind? What makes you really curious? And we need to start from there, and we need to prepare the mind before we just randomly use the scales. Wherever we are, we have experienced a certain light, and we know some things. All of us have that light in us. And as we learn more, that light of knowledge, that circle of knowledge expands. But as Einstein says, so does a circumference of darkness around it. Our ability to identify that circle of darkness is the point where research can begin. Acharya Charaka says that the entire world is a teacher for the intelligent, and it's an enemy of the unintelligent. Because going out and learning and seeking to learn from any place is the mode of Ayurveda. And that's what Charaka did. Charaka did, 2000 years ago, he went to study also from from the people, from the tribals and the villagers. He had this understanding of the sutras in his mind, but he went to see the real applications from them. Now, if Chalaka really existed at this time, do you think that he would not learn from all of the teachers of biology around out here? Would he not learn to see? Would he not seek to learn? That openness that's there in Ayurveda is the legacy of Ayurveda, which is what we need to continue to take to the future with us. And while we are doing that, there is another sutra which says, let humility and relentless enterprise guide your quest. With that, I end my presentation and I'm open for questions and conversations. Thank you, Council for Ayurveda Research, for giving me this opportunity.
You want to stop sharing your screen?
I want to do that. Yes.
All right, let me put everybody in gallery view. Everybody can come on video or unmute if you like. I actually had to message my client. I'm running a little late and I decided to stay.
Thank you.
Amazing, very engaging. Thank you for showing all the behind the screen, steps and the story behind, your very first research project as Ayurveda Vaidya scientist. Fantastic, very, very inspiring. And I actually was remembering my own MD thesis journey where I actually took out curfew passes. And I actually, because that is when the Babri Masjid had come down. Oh. And I was doing Antardhum Tamra Sindur on Grand Mal epilepsy, Apasmar. And it was in Savai Mansingh Hospital under Dr. Ashok Pangadia, who later got, Padam Shri and all that. So wow. Very, very much reminiscent of, when you have the passion, when you want to seek out, you will find ways to do it. But excellent presentation. Sorry, I jumped into commenting right away. I'm going to open it to everybody. Please feel free to comment, share, and ask questions. Please go ahead.
Hi, Nancy. I want to recognize the presence of Dr. Remy. Remy, are you here? Can you?
I see somebody here? Yeah.
Yes, I am. Hello. That was a wonderful presentation, Nami. That was fantastic.
Thank you, Dr. Remy. So Dr. Remy is the chief of the director of integrative medicine at Wake Forest University, and he's the founder of MD Ayurveda.
Oh, lovely. Thank you so much for coming to this, initial talk in our series. Hopefully we'll see you more.
Well, thank you for inviting me and having these talks. I'm thrilled that they're there. This is a great, obviously great presentation by Nami, but really the fact that you're having these are wonderful. The building the evidence base for Ayurveda is tremendously important, as obviously you all know, and this is a really good venue of sharing research findings and be able to communicate with each other about the research that's being done. So kudos to all of you for doing this.
Thank you. We also have monthly journal club meetings, so do check out our website. I would love for you to check out and probably maybe even join us, advise us.
Love to.
Thank you. Thank you. All right. Anybody else would like to comment, ask questions?
I'm so inspired by both of you, Vaidyas. You're my teachers also from Kerala Ayurveda. Mm-hmm. I'm an AWP student, but I'm very passionate about Ayurveda. And this meeting today kind of connects a lot of different points for me. My father had Parkinson's, and I was only 5 years old when he was diagnosed, and it was the catalyst that made me question my whole life. Is there another way of dealing with sickness and illness, especially at that level, that made me question and go into a holistic study. And just listening to the journey, Dr. Namyata, that you went through to research, it's so inspiring to me because these patients suffer quite a lot. And if there's another way besides the allopathic medicines, it would be miraculous. It can change the life, because the allopathic medicines, even though they correct the side effects, it destroys so much of the human being on so many levels. And that is such a strong experience to witness, especially from childhood for 20 years to witness. So it gives me so much hope for future. I lost my father now, but for other patients that are suffering, it's so, so important. And this platform is so incredible. Yesterday, I was beginning my studies to take the NAMA exam, and there were some questions about the history of Ayurveda, and I wanted to understand and research more. So I started looking and Googling different research places, and I came upon the Wikipedia entry that's online, and I wanted to cry when I read it, because the very first sentence says Ayurveda is, not a real science, and it's considered in the Indian Medical Association to be quackery. And I thought of you right away. I need to contact my teachers and say we have to rewrite that Wikipedia, because there's so much untruth and so much lack of understanding about the science. So please, if you can rewrite that, because it's not the correct representation for Ayurveda.
Right.
And just thank you.
Have to find out who can do that.
May I say something to that effect?
Yes.
This is Remy Cueto. I really appreciate you bringing this to everybody's attention. It's very important. I served on the board of the Society for Acupuncture Research for many years. And so we had the same issue with Wikipedia, because Wikipedia also considered, or the postings in Wikipedia said that acupuncture was a pseudoscience, and they really falsely represented the science and the evidence. And so the Society for Acupuncture Research looked into that. And there is we don't know what's going on. We couldn't change it. There is it's not as easily changeable as as Wikipedia seems to suggest. So we weren't able to find out how to do it, but it was, there were many challenges, and there are viewpoints that are being provided in Wikipedia, which are actually factually not correct.
Maybe we should engage NAMA in this, because NAMA is a large organization and they might have a better entry point into editing, or at least putting a counter opinion out there that the Ayurveda fraternity does not believe this to be a true depiction of what is Ayurveda. So I think we should take that up.
It's not as simple as that, actually. It truly is not, because it's not a matter of numbers. It's about really sort of being able to show with data about what really occurs, right? And that's something that we are not, unfortunately, really able to do as a profession. And I hope that we are able to change that through other means. I used to actually donate to Wikipedia when they started doing that.
There are a couple of petitions on that issue already been filed. I can share the link with everybody. Sign it, and then definitely a good idea to bring up with the NAMA also.
With NAMA, yeah.
Rest of the associations, so that we all can collaborate and
collective push.
Yeah.
And the data goes both ways, Navi, because the onus of proof is also on them.
Sure.
So, I mean, if someone really starts to petition properly, this can be challenged very easily. It's just that we need to do it through an organization that has the bandwidth to do that in terms of human resources and all that. Yeah.
Sure.
So NAMA would be probably the right organization for that.
All right. I wanted to add that this thing has started and the correction was made, but it is in the hands of the editors and they changed it back to writing as Ayurveda is a science of quackery.
Yeah, so it's maliciously driven.
Yes,
it's
it is
not
actually,
incidental.
the intention behind is actually, that's what you said correctly.
And that's what we concluded and found out with acupuncture as well. We think that there is intention behind there with the editors that block the accurate representation of the data.
Right.
It is the same person who has done for the acupuncture. It is the same who has done for the same.
Really?
Yes.
Oh,
it's one single person?
Yes, it is the same editor.
What's her name?
I don't know her name, but somebody has posted in one of the group. So I have seen that post. Yeah.
We should take this up and at least propose to NAMA from our end, because actually this needs to be done across the board. If you go on NIH, it's not a pretty description of Ayurveda there either. So it's a very maliciously driven sort of defamation. Keep them controversial, keep them as quacks, and they get to reap the benefits from that.
I believe that the NIH, the NCCIH is, and I just happened to have seen it this morning. It's only a couple of paragraphs, and at the end it talks about the potential of lead poisoning. Really, that's what it says. But I think the NIH is more, the NCCIH is much more willing to follow the evidence. I think they would be more receptive to communication than Wikipedia seems to be.
I agree. And the current director of NIH is from Boston, actually, so I can find out her coordinates.
There's somebody from NCCIH who is in touch with me for cancer, cancer in Ayurveda. I can reach out to him also if we go through.
We should. I think we should do all of the above.
We can do it with as an organization, then that would be very good. So,
yeah.
Yeah, it is definitely a very big undertaking, but if all of us we unite and we do the work, actually it will happen, because there is a lot of research available, and we are not out of data for sure. I mean, there is so much data building every single day. We just have to collect all of that and make sure that they are aware of this data.
It needs to be in a comprehensive paper is what I mean. I feel that we need to put it down in the comprehensive paper and then publish it in a good journal, and then
absolutely, it's very scattered.
Use that.
I think also offensive and defensive. We should do the defensive, but we should also ask them, where is your data? How do you claim what you claim?
Absolutely. When you make a claim, you must have some data.
Yeah. On what basis has Wikipedia approved that?
I want to share one story, another story of statins and Gugulu. Gugulu for hyperlipidemia has been Dr. Satyavati's work from 1968 onwards, from her thesis, and so many studies in India with Gugulu and cholesterol. And then eventually in 2003 or 2004, there was one published in JAMA that, Gugulu does nothing to cholesterol.
I saw that.
Right? They did that study. They have some of that data. And you know how in India, we use the Purana Gugulu, right? For doing the treatment. Right. It's not Nava Gugulu. It is a Purana Gugulu. And they use Nava Gugulu and they got some results. They don't want to sort of respect the whole process of it. And they published it, and it actually really
damaged.
And now it is out. Statin patent is no longer there. Therefore, they might not even be if we have a counter to it, it will again.
That study was horrible. They had not even done the Shodhana of Gugulu. And there was no Pathya. And in Ayurveda, we never used pure Gugulu ever. It's always in a formulation. So all of those things were missing. Pathya was missing. You can't be eating beef every day and say, I'm going to just take Gugulu and get my cholesterol down.
In the same way with the lead poisoning also, the lead poisoning paper, actually they have collected the sample from Indian stores, and it is just on that they have made it so public at all platforms that all Ayurvedic medicines having lead are causing poisoning. And this is such a, like, same way intention behind this, so malicious intention.
So interestingly, I did end up working with Dr. Robert Saper later when I did my MPH from BU. Dr. Robert Saper is a guy, right? Do you remember his name?
Yes.
I told him I offer my body. So I have an MD in Raj Shastra. I said I'm the metal doctor. So take my body, and I'm consuming these products, and you know why I'm offering myself for lead toxicity studies and whatnot. He never took it up. I thought he's listening to reason, but then I saw another horrible study from him. So it came out that they had a fellowship fund, and this was all very motivated. So I mean, that part also, there was not a single Ayurveda doctor on the study panel, and this was a man who was consuming this as an OTC product for 10 years, which is not what Raj Shastra medicines, how they should be used. There were a lot of things wrong with it. But I'll have to sign off. Dr. Remy, can I take your contact info from Dr. Nami and
Please do.
email you? We would love to have you in some kind of advisory role in our organization.
That would be wonderful.
Thank you. Any other questions and comments?
Well, it was a story, so.
Yes, but it was a wonderful presentation. Knowing the story behind the research is equally motivating.
And it was so
and it shows us the way also. So thank you for sharing the story and pictures.
Thank you.
Wonderful presentation, Nami.
Thank you.
Nami, I must say that I was supposed to pick up my daughter at 2:30, and I told her to the Uber and come home.
Bye-bye.
All right, bye-bye. See you on the next one. All right, thank you, everyone.
Thank you.
Thank you. It was awesome.
Thank you.